Hello, my name is Alistair, and for this final project, I chose to talk about whether providers should initiate a hypocaloric diet for obese patients within an acute care setting. I chose to talk about this question because of the prevalence of obesity. So the U.S. Department of Health and Human Services indicates that 42.4% of Americans meet the criteria of obese. But in addition to that, like very little is done about it. So Srivastava et al. 2018 found that only 6% of obese patients had obesity addressed in their care plan, and only 37.5% of patients even had obesity documented within their chart. So there was like a clear disconnect between like the prevalence of obesity and what was being done about it in the inpatient setting. And I had never seen anything done about it in my like clinical experience. So I kind of just wanted to figure out why. So the first thing I did was I came up, with some initial like assumptions and concepts as to why there may be a lack of implementation for obese patients within the inpatient setting. I came up with a few different ones, including, but not limited to, reduction of obesity is rarely viewed as a treatment goal in the inpatient setting. Obesity is not considered or noted in a patient's medical record. Patients should have the autonomy to choose whether or not they want a calorie restriction, and a few other ones. Feel free to take a look at my concept map, which will be attached to this discussion if you want to see all of them. So when I began doing some research, like I said, I found that there's a disconnect between like the percentage of obesity that is in the country and interventions that are being placed. Some of the reasons why is Srivastava et al. 2018 found that although physicians were able to identify obesity and believed it to be bad, a lot of them, were reluctant to document or treat obesity due to the lack of treatment options within the inpatient setting and due to like patient sensitivity to the topic. So in that same research, I found that there are some best practice recommendations when it comes to diets of obese patients within the inpatient setting. Chobin et al. 2013 found that a nutrition assessment and formulation of a nutritional plan should be implemented for all patients, whether they're obese or not, within 48 hours. And then Chobin et al. 2013 and Dickerson et al. 2022 found evidence that supports a hypocaloric, high-protein diet for obese patients within an inpatient setting. Dickerson et al. In specific found that a hypocaloric, high-protein diet leads to better clinical outcomes for patients. And so that was the intervention that I ended up recommending for this project. In order for my theory application, I chose Swanson's theory of care and healing. It has the assumption that caring is correlated with healing, and that application of the 5 processes, which include knowing, being with, doing for, enabling, and maintaining belief, will allow the patient to feel comforted. So I made a, theory-informed conceptual map, which will be attached to this document, to this discussion. And it goes through all of the 5 processes. So it's, begins with knowing. The nurse provider gets to know the patient and understand the surrounding circumstances of why the patient's there. Being with, which is where the nurse provider ensures that they are present with and for the patient. Doing for, which is where the nurse provider treats and cares for the patient in the same way that they would want to be cared for. And enabling, which is where the nurse provider provides education to referrals to the patient and family. And all of that must go along with maintain belief in the patient's ability to heal and behavior change. So in this instance, the doing for, the intervention, would be recommendation of a hypocaloric, high protein diet for the patient, the provider who puts in the orders, or to the patient. If all 5 of those processes are encompassed, hopefully the patient will feel capable, valued, hopeful, understood, and safe. I think and believe that this theory goes well with the clinical question, because its primary focus is caring of the patient and putting the patient in the best possible position to heal. If we want to do that for obese patients, if we want to put them in the best possible position to heal, we need to implement these hypocaloric, high protein diet, because it's proven to have better clinical outcomes. And even if once the patient leaves the hospital, they go back to a poor eating habits, while they're in the hospital, we should do everything in our power to get them to heal. My greatest aha moment when I linked the clinical questions and concepts and theory to the implementation strategies is the fact that this is a relatively simple intervention that can, at least in my opinion, be implemented for every single obese patient. This isn't something that takes lots of money or that takes lots of overhaul. It's simply limiting the diet that the people eat and putting them in the best position to heal. My takeaway that I hope you guys take away from this is I hope you guys just realize the benefits of a hypocaloric, high protein diet and hopefully recommend it to your patients. If we truly care for our patients, we should be advocating for them and doing everything in our power to put them in the best position to heal, which the evidence shows that that includes, recommending a hypocaloric, high protein diet for the patient. And yeah, if you have any questions, feel free to comment in the discussion. Thank you.